Nanda sir, lecturer physiotherapist at SP Nittar, to kindly come onto the stage and preside over the upcoming session. It is now my honor to introduce our second speaker of the day, Professor Dr. Deepak Kumar Capri sir.
Hello,
With
hello,
over 3 decades
hello.
of clinical and academic excellence, Professor Dr. Deepak sir is a leading authority in manual therapy and musculoskeletal rehabilitation. A certified McConnell concept instructor, he has trained over 16,000 physiotherapists across 52 countries. He is the author of the book titled Manual of Mulligan Concept and a visiting consultant physiotherapist with Emirates Health Services UAE. A recipient of Visionary Leadership Award, he currently serves as the director and senior consultant physiotherapist at the Capri Institute of Manual Therapy. Today, he will be speaking on manual therapy, learn the technique that always works. Please join me in warmly welcoming Professor Dr. Deepak Kumar Capri sir to come on to the stage.
Thank you so much for the introduction, and thank you very much, all of you, for coming here on Saturday morning. And my gratitude and thanks to PP sir, Mona ma'am, and all the faculties for giving me this opportunity. Coming back to Nirtar and delivering lecture is very emotional and nostalgic for all the Nirtarians. When we come here, we really enjoy sharing what we know a little bit. So I'm sure I'll be doing justice to why PP sir has invited me. So I'll be taking the class on manual therapy, and with the time allocated, I'll try to do as many techniques as possible. This is more of a demonstration class, but before finishing the demonstration, I will be finishing some of the theory so you understand why we are doing or mobilizing in that particular certain way. With me is Dr. Tanmay Kumar. I'll be handling the dais and he'll be doing all the demonstration. He is also a doctorate in physical therapy from Montana University, and he has done more than 100 workshops with me and trained more than 5,000 physios across the world. So, and I'm very happy, feel very proud that he's my son. So, thank you very much for inviting Tanmay also. And you will be glad to know it's not only my son who is a physio, even my daughter is also a physio. She has also done the doctorate in physical therapy. Then my daughter-in-law is also physio. So by chance, my son-in-law he's not a physio. He's from BTech and MTech from Delhi IIT. So, but we all are physios except my son-in-law, because when he was taking admission, I had no control over him. So his parents got him into IIT. And it's not that my kids choose because I asked them to become physio. They wanted to be physio from very beginning. Shuru se hi. And they are the one who used to secure 99.9% kind of category से बच्चे ये belong करते हैं 10th and 12th class में. So if they would have taken NEET exam, they would have easily got selected. And the important thing is they didn't go for NEET exam at all. They didn't appear. They appeared only for physiotherapy entrance exam for Delhi University, single exam, and they got selected. And now you must be wondering why. खुद तो बेवकूफ कुएं में कूदा, अपने बच्चों को भी लेके कूद गया, कैसा बाप है ये? क्योंकि आई एम श्योर मैनी पीपल मस्ट बी वंडरिंग कि यार कहाँ आके फंस गए हम फिजियोथेरेपी में, क्या जिंदगी है, काश कि तब सही डिसीजन लिया होता. सो सॉरी. Yes, thank you very much. I couldn't hear you properly. Can you say it loudly? नहीं नहीं ऐसा नहीं है कि इंस्टीट्यूट तो बनते हैं, बिगड़ते हैं, टूट जाते हैं. देयर हैज टू बी ए सिस्टम, देयर हैज टू बी ए सोल टू व्हाट यू आर सेलेक्टिंग, एंड दिस इज द सोल. टिल नाउ देयर इज नो मेडिसिन to improve the muscle power till now. They are depending only and only on physiotherapy, not a single medicine. And I don't see future in next 20-30 years they are developing a medicine which will help you in developing the muscle power. So physiotherapy is the only answer. No medicine to correct the posture. मेडिसिन खाया और आपका स्कोलियोस ठीक, मेडिसिन खाया आपका स्टूपिड पोस्चर ठीक, मेडिसिन खाया आपका पेल्विक का टिल्ट ठीक. टिल नाउ नो मेडिसिन, एंड इन फ्यूचर आल्सो देयर इज गोइंग टू बी नो मेडिसिन. नो मेडिसिन टू इंप्रूव द मसल पावर. Have you ever imagined? There is no substitute to what you people and we people are doing. There is absolutely no substitute what we are doing. No medicine to improve the gait. And hands on, there are so many things that medicine cannot help. It's only and only physiotherapist can help. And thanks to the medical fraternity, medical system, we are going to live much more longer than our ancestors. The medical system is going so well. And no matter who you are, how big you are, you will grow old. Your kidney will not support medicine. Your liver, your lungs, they will not be supporting. And for anything and everything, you will be dependent only and only on physical therapist. At present, we are young India. But when you people comes in the mid-age, probably India will be a mid-age or the old-age India, and you will have so many patients. Yesterday, Dr. Umashankar Mohanty took a beautiful lecture, and I also learned so much from him. And I'm blessed that he is sitting here and PP sir is sitting here. Yesterday, we discussed that we are a complement to each other. And along with that, yes, we discussed that when you open a clinic in an area where you have so many other clinics, there is a chance of hitting your clinic or getting success in your clinic is much higher than you are opening a clinic in an area where there is no clinic. Because slowly the population is increasing and there is no substitute to what you are doing. And one thing I always hide, it's never mentioned in my biodata or in my introduction, I have completed my MBA also. And after PhD, I have done my MBA. And in MBA, I learned if there is no substitute to what you are selling, you sell it at your terms and conditions, you sell it at your cost. This is what physiotherapists need to understand, and they need to learn. I don't know why they are selling for so cheap rate. And हमारे टाइम पे हम लोग बोलते थे यार हमें मालिश वाला मत बोलो, मालिश वाला मत बोलो, है ना? शायद अभी भी यहाँ पे चलता होगा मालिश वाला मत बोलो. मैं कहता हूँ यार काश हमें मालिश वाला भी बोलते तुम. मालिश वाला दिल्ली में होम विजिट के मालूम है कितना चार्ज करता है? 5,000 rupees. And physiotherapists charge only 2,000 rupees. And in my clinic, no patient goes without getting some effleurage or some rolling. Like after manual therapy, after electrotherapy, whatever you're doing, if you're not touching the patient, if you're not draining that area, if you're not releasing that area, if you're not mobilizing the myofascial release, if you're not mobilizing the nerves, massage does not mean the luxurious massage. Massage can also be the therapeutic massage. One of my friend, A.G. Kesina from Nirtar only, he has written beautiful books on therapeutic massage. Danpani sir, you might have heard his name. He taught us massage in our BPT. Massage is an integral part, but yes, not as a luxury one. Use it as a therapeutic one. Use it in a scientific one. Use it for that joint, not for the whole body like Kerala massage. That's a different story altogether. So, see where the physiotherapy profession could have been, which we missed out some very important component of our therapy, and majority of the therapists are ashamed of doing that particular maneuver, which as a clinician, I feel that must be given. If there is upper trapezitis, you mobilize the cervical and thoracic spine, but if you don't mobilize that upper trapezius muscle, patient won't get much relief. So, in layman term, is it not a massage? Yes, it is a massage. Okay, I won't get deviated from the topic, but yes, there is a huge scope in the physiotherapy profession. So it's not that they want to carry the legendary of the Capri or other things, but they took a very informed, wise decision becoming a physiotherapist because they see there is a huge scope of physiotherapy. And it's not only Deepak Kumar who's making money in crores. There are so many physiotherapists in Mumbai, Delhi, Bangalore, Chennai. They are moving in Mercedes. They are making crores. So please stop blaming your profession, your institution, your association, or your council. It is you who yourself is responsible for being middle class or the upper middle class or the lower class. So those who are poor physios, believe me, even if you were MBBS or engineer, you would have been poor only. You need to change the mindset. It has nothing doing with the profession, nothing doing with the profession. Because I have seen professionals only selling tea after doing MBA. I'm sure you people know MBA Chaiwala. Millions of rupees he's making. Then there are saloon people making millions of rupees. चाय वाला बना सकता है, जूते वाला बना सकता है, अंडे बनाने वाला बना सकता है. तुम लोग साइंटिफिक लोग हो, साइंस पढ़ के आए हो, मेडिकल कॉलेज में पढ़ रहे हो, and then if you are staying poor, it is you who has chosen to be poor. It's not the system, it's not the profession, it's not the institute or not the society. बेस्ट से बेस्ट ट्रीटमेंट देते हो पेशेंट को, अच्छा वाला ट्रीटमेंट देते हो और पेशेंट बहुत इंप्रेस हो जाता है आपसे और उसके बाद बोलता है डॉक्टर साहब मजा आ गया, सिंगल सिटिंग, वाओ व्हाट ए ग्रेट फीलिंग, थैंक यू वेरी मच, हाउ मच, एंड आपके मुंह से निकलता ही नहीं है, यू आस्क ओनली फॉर 300 और 500 रुपीज. और वो पेशेंट मर्सिडीज से उतरा होता है, बाहर उसकी मर्सिडीज लगी है, 500 देके जितनी वो आपकी इमेज सोच रहा होता है कि वाओ डॉक्टर डॉक्टर डॉक्टर, जैसे ही आप टोटल 500 रुपीज मांगते हो वो आपको उठा के जमीन पे पटक देता है. बिकॉज अभी जब लंच करके आया था अपनी वाइफ के साथ 500 रुपए तो उसने टिप में दिए थे वहां पर वेटर को. यू आर लेस देन ए वेटर नाउ. आप लोग अपनी वैल्यू कब समझोगे मुझे नहीं मालूम. थिंक अबाउट इट. सो माई किड्स रियलाइज दैट, and it's not only my kids, the daughter of my brother is a physio, the son of my sister is also physio. We are 7 physios living in the same house, so we are enjoying that. Because long back we realized medicine can change physiology, not physics. And we physical therapists deal with the physics of the body. This physics cannot be corrected with the medicine or surgery. It is only and only physical therapist can change it. And PP sir do a lot of spine, I do a lot of spine, my PhD is in spine only. This is what I see the future of physiotherapist. Unfortunately, physiotherapists are not very good in spine because spine में से क्वेश्चन कम ही आते हैं, पेरिफेरल से ज़्यादा आते हैं क्वेश्चन. So usually हम वही अपर लिम लोअर लिम अच्छे से पढ़ के जाते हैं. And जिन्होंने पढ़ भी लिया spine, then also they don't visualize the sympathetic nerves coming out from the same intervertebral foramen. What we physiotherapists see is the spinal nerves coming out and then making the brachial plexus or the lumbar plexus and then becoming a sciatic nerve or radial or ulnar nerve. However, from the same intervertebral foramen, the sympathetic nerves are also coming out. And if there is a scoliosis, if there is a hypomobility, if there is an osteophyte formation, don't you think even these sympathetic nerves will get compressed? And if they are compressed, won't they affect your other system of the body? And the same thing are treated those elements are treated by chiropractor by mobilizing the spine only. They are treating asthma, they are treating high blood pressure, low blood pressure, they are treating constipation, they are treating indigestion, they are treating thyroid. So many things they are treating by mobilizing the spine. My question is, why can't physiotherapists do that? We mobilize the spine better than them, much better than them. And many of you are blessed to be studying in the Nirtar or studied in Nirtar. And PP sir is one of the best teacher I have ever come across. I didn't have opportunity to learn from him because he was my senior at that time. He was not taking the classes. I wish I was born after 5 or 10 years. I could have learned directly from him for many years. So you people are blessed. Think about this spine. Okay. This is what the future of physiotherapist I see. Physiotherapist treating the diabetes. There are many cases they have reported that physiotherapist mobilized the spine, and after mobilization of the spine, patient fainted. Why? Because patient was a high blood pressure patient, hypertension patient, and he took the medicine for the hypertension. But after mobilizing the spine, probably it stimulated the sympathetic nerves also, and the blood pressure fell down too much, and then he fell down. That suggested if you mobilize the appropriate segment, you can treat the hypertension, you can treat the diabetes of the patient. So this is what now our association is working on. Instead of calling it a physiotherapy, now they are advocating it to become a physiopathy. Like you have allopathy, Ayurveda, and homeopathy. Like that, one day we'll have physiopathy also, inshallah, one day, sure. So I'm glad, sir told me there are many of the clinicians sitting. Usually in the conference, always the students are sitting. But those who are clinicians, raise your hand, please. Thank you. Those who are MPT students, raise your hand, please. Wonderful. Great. Thank you very much. So I'll take the class accordingly in that direction. So what we are going to do is, we are going to demonstrate few techniques here. And I'm going to pass all the information of that technique. This is not a trailer to my workshops. This is a workshop. Okay? So don't think I'll pass a little bit of information about that technique. No, I'll pass full information about that technique. Pay full attention. And do not try to record. Record करने में आप बार-बार तो screen पे देखते रहोगे, समझने का ध्यान ही नहीं रहेगा आपका. Try to see that directly here. And as far as the recording is concerned, let me tell you, these techniques are available on my Instagram channel and YouTube channel. So you can go and watch them again and again. So right now, concentrate on me. मेरे जितनी सुंदर हसीना आपको यहाँ नहीं मिलेगी. So I want you people to concentrate only on me or Dr. Tanmay performing on the stage. Okay? So, and in between, if you have any question, just raise your hand. No need to write down the question and go to the end. Okay, maybe if it is a relevant question, I'll entertain it there. But if I think I should be answering it in the end, I'll request you to control your emotion and I'll answer that in the end of the class. Okay, so thank you, because you people have already realized if you only do what you can do, you will never be more than what you are now. So you have realized that you want to upgrade yourself. You want to go to the next level. You want to learn more things so you can do more things. जितना आपको आता है उतना ही आप करते रहोगे तो उतना ही कमाते रहोगे जितना आप कमा रहे हो. You, in order to earn more, you need to learn more. This is a hard fact of the life. Okay? जितनी आपकी कैपेसिटी उतनी कैपेसिटी से आप कमा रहे हो ऑलरेडी. अगर ज्यादा कमाना तो ज्यादा सीखना पड़ेगा ना, तो पूरी अटेंशन देना. So if the only tool you have is a hammer, you tend to see every problem as a nail. I'm not going to cover only one particular concept here. I have merged it and mixed many concepts in last 33 of my practice. I have realized every concept has its own strength and its own weakness. So what we have done, we have made a lassi out of all the concept. So I'm not going to teach you one particular concept. I'm going to teach you best of each concept. अगर ग्रिप मलिगन की अच्छी है तो मैं मलिगन की लूँगा. मूवमेंट ग्रिप अगर मैटलन की अच्छी है तो मैं मैटलन की ग्रिप लूँगा. मूवमेंट मलिगन ने करना बोला है तो मलिगन को करवाएंगे. सस्टेन करना सीरियक्स ने सिखाया है तो सीरियक्स वाला करेंगे. और तीनों को मर्ज करके हम एक अलग नया इंडियन कॉन्सेप्ट निकालेंगे, उसके बेसिस पे हम करेंगे. Okay? Because लाल रंग के चश्मे से देखोगे तो क्या दिखेगा? लाल ही दिखेगा। चवन्नी बचाने की कोशिश करोगे तो क्या बचेगी? चवन्नी बचेगी। थिंक बिगर। रुपए बचाना है तो रुपए की तरह से सोचना पड़ेगा आप लोगों को। ओके, सो लेट्स स्टार्ट नाउ. It's going to be two-way process, not one-way process. I'll be asking questions from you. Luckily, sir ने मेरे को काफी टाइम दिया है तुम लोगों का दिमाग खाने के लिए. So it is going to be two-way process, and it's okay to give wrong answers, funny answers, and non-scientific answers, but try to participate as much as possible. So what is manual therapy? What is its benefit? Can anyone tell me the physiological effect of manual therapy? Anyone? Just one line, single line. और जोर से बोलना, माइक आने में जाने में टाइम बर्बाद नहीं करेंगे, वहीं से खड़े होके कोई जोर से बोलो. Increase blood circulation. Very good. Clap for him. Absolutely beautifully wrong answer. Even in my BPT, I learned the same. In MPT, learned the same. PhD, learned the same. Now it is high time for we physio to understand. एक काम और करना, रात को ना किस दिन 1-1:30 बजे तक जागना. जब टीवी चैनल बंद हो जाते हैं ना, वहां पे एक हैंडसम सा लड़का आता है, लेडी आती है, कोई चप्पल बेच रहा है, कोई बेल्ट बेच रहा है, कोई मैट्रेस बेच रहा है, एंड एवरीवन इज सेइंग व्हाट. ध्यान से देखिए इन मैट्रेसेस को. इससे आपका ब्लड सर्कुलेशन बढ़ता है, लैक्टिक एसिड वॉश आउट होता है, विटामिन आते हैं, मिनरल्स आते हैं. एंड यू आर सेइंग द सेम थिंग. देन व्हाट इज द डिफरेंस बिटवीन यू एंड ए क्वैक? You are a qualified quack and they are unqualified quack. That's the only difference. फिजियोथेरेपिस्ट से पूछो शॉर्ट वेव कैसे काम करती है.
हेलो.
इंक्रीज इन ब्लड सर्कुलेशन, मोर ऑक्सीजन, मोर फूड सप्लाई, वॉश आउट ऑफ द वेस्ट प्रोडक्ट. माइक्रोवेव कैसे काम करती है? इंक्रीज इन ब्लड सर्कुलेशन, मोर ऑक्सीजन, मोर फूड सप्लाई. हाउ द पैराफिन वैक्स बाथ वर्क्स? इंक्रीज इन ब्लड सर्कुलेशन. अल्ट्रासाउंड, इंक्रीज इन ब्लड सर्कुलेशन. कोल्ड पैक, initially vasoconstriction, then there is a vasodilatation, hence there is a increase in blood circulation, more oxygen, more food supply. How the stimulation works? And the teacher thought कि potassium ion channel के बारे में बात करेंगे, change होने का, and the student gave the answer, sir, when you contract the muscle, yes, so muscle give a pumping action on the blood vessels, hence there is a increase in blood circulation, more oxygen, more food supply. Are we not like a Dracula? सिर्फ लाल रंग का ब्लड ही दिख रहा है और कुछ दिख नहीं रहा. पेशेंट चल के आ रहा है तो 5 लीटर ब्लड का भरा हुआ ड्रम चल के आ रहा है. शॉर्ट वेव लगाया, इंक्रीज इन ब्लड सर्कुलेशन. अच्छा मेरे को एक बात बताओ, जब यहाँ का ब्लड सर्कुलेशन आप बढ़ा रहे हो तो आर यू सप्लाइंग सम एक्स्ट्रा ब्लड टू द पेशेंट? चढ़ा रहे हो, ब्लड चढ़ा रहे हो उसको एक यूनिट. तो यहाँ का ब्लड सर्कुलेशन अगर बढ़ रहा है तो इसका मतलब कहीं का कम भी हो रहा होगा. ये कौन सी तुमने अच्छा ट्रीटमेंट किया? और वो ब्लड सर्कुलेशन यहां से किडनी से कहीं से कम हुआ तो पेशेंट कहते हो लगा दी तुमने. You're more like a hematologist. And if the physiotherapy was increase in blood circulation, syllabus finishes in 15 minutes. कोई भी ट्रीटमेंट दो, increase in blood circulation. This is much more than increase in blood circulation. And there are so many evidences, so many literature, so much of publication work which says there is no significant increase in blood circulation. Significant word is important here. There is no significant increase in blood circulation, no significant decrease in lactic acid level, no significant uptake of oxygen saturation, no significant. And that's why when you go to US, you will realize insurance company won't pay you when you do short wave or other electrotherapy. They will pay you only for exercise therapy. They will pay you only for the soft tissue release. They will pay you for the ergonomic management. They will pay you for the manual therapy. Those things are not paid because they have accumulated enough evidences, enough researches that says it is all placebo, placebo, placebo. Now you must be asking, sir, आपके clinic में चलता है क्या ये? Huh? I still do electrotherapy? Yes. Okay? Because I believe in one thing. I don't believe in evidence-based practice. I believe in practice-based evidence. Because I have seen people responding with the electrotherapy very much. Very much. It may be statistically relevant, but clinically irrelevant. And it might be clinically relevant, but statistically irrelevant. So I believe in that funda. So electrotherapy, yes, I do use. Because even placebo treatment is a treatment. With manual therapy, patient comes and 2-3 minutes you mobilize, actually patients become all right, actually. But then you have to charge also. Isn't it? I have to pay my EMIs, I have to pay I have so many expenses, so I have to make money. So it will be difficult. I'm not only going to teach you manual therapy, probably I'll teach you the practice also, how to run the private practice. I'm a hardcore clinician, less academician. Okay? So I'll teach you how to make money also. So if you don't put lal, neela, pila, batti and the machine is not very attractive machine, patient will be reluctant to pay you. And when you put all those things, patient will pay you. And it is okay to put those machines only when you know that this is a placebo and the real treatment is the strengthening exercise, stretching exercise, ergonomic management, manual therapy, mobilization. Till then it is okay. But when you know only electrotherapy is going to help the patient, then you are doing the quackery basically. In acute phase, okay, maybe yes, then cold pack itself is a good therapy. Rest is a good therapy. Do the taping, do the cold pack. Makes sense? So with manual therapy, when you mobilize it 20 times, no, there is no increase in blood circulation. Also on funny side, if increase in blood circulation was the best treatment, Bell's palsy का केस आया, एक कान पे जोर से लगा उसके. Guaranteed increase in blood circulation, Bell's palsy ठीक. Home management क्या? बीवी से 4 थप्पड़ सुबह 4 शाम को. Patient ठीक. ऐसे नहीं होता है. Okay, so sorry, increase in blood circulation. Thank you, but thank you very much. It's a wrong answer. Okay, and thank you for saying this because then I could explain why blood circulation is. And अच्छा electrotherapy में ना हमने short wave में क्लेटन की बुक थी तब 9th एडिशन नया नया आया था बट हम सीनियर से लेके बुक पढ़ लेते थे 8th एडिशन 7th एडिशन भी क्लेटन का उसमें था नी के ऊपर क्रॉस फायर लगाना है हमें शॉर्ट वेव है ना और क्या एक्सप्लेनेशन दिया हुआ था थ्रू एंड थ्रू जाएगा सो देयर इज ए इंक्रीज इन ब्लड सर्कुलेशन क्लेटन अंकल को बोलो अंकल नी जॉइंट के अंदर ब्लड सप्लाई नहीं होती है अगर नी के अंदर ब्लड आ गया दैट इज कॉल्ड हेमरथ्रोसिस इट इज ए कॉन्ट्राइंडिकेटेड फॉर शॉर्ट वेव डायथर्मी yes or no you please start challenging your books start challenging your teachers in a healthy way you are science students you should always ask question why when where how why not this way why not that way and try those things this is how actually the research happens you have to challenge the present whatever going on in present you have to challenge those things if you don't challenge you will not grow of course do it in a very nice polite and constructive way not to just irritate your teacher or the faculties or to insult the author of the book but do it in a nice way and you have to learn that way okay so if there is no blood circulation and the joint do not get again if you are thinking increase in blood circulation में joint में nutrition जाएगा joint के अंदर blood supply नहीं है तुमने blood circulation बढ़ा भी दिया तो भाई blood supply नहीं है तो कहाँ से तुम उसका blood circulation बढ़ा दोगे joint cartilage get nutrition because of the movement of the synovial fluid and the synovial fold so again it is the mobilization who is going to mobilize the synovial fold and the synovial fluid hence that will give nutrition to the joint not because of increase in blood circulation does it make sense okay so anyone else who wish to give another choice another point एंड उसकी मैंने उसको थोड़ा सा मजाक में ले लिया उससे डरना मत यू कैन गिव द आंसर इट्स ओके ब्यूटिफुल, लवली, थैंक यू वेरी मच। एंड पीपी सर ने मेरे को परमिशन दिया कि मैं पूरी अपने स्टाइल से क्लास ले लूं, तो सर मैं अपने स्टाइल से ही क्लास लूंगा, है ना, बाद में मुझे डांट नहीं मारना कि दीपक ऐसे क्या बोला तूने। ओके, इंटेंस स्टिमुलेशन टू द मैग्नोसेप्टर्स and proprioceptors in and around the joint. When you do the electrotherapy or hot pack, how long you should give minimal to stimulate the pain gate mechanism? कितने मिनट? 10 minutes. That's a commercial answer. Academic answer is 15 to 20 minutes. पेन गेट मैकेनिज्म वाइब्रेशन लगाना है, टेंस लगाना है, उसके बाद होता है। हम प्राइवेट प्रैक्टिशनर 10 मिनट का ये लगाया, 10 का वो, 10 का ये, क्योंकि हमें 4 चीजें लगानी है, ऐसे कैसे? रियल में 10 मिनट से कुछ नहीं होता है। दैट्स नॉट इवन ए आई वॉश, दैट्स नॉट इवन ए प्लेसिबो, ओके। सो बट व्हेन यू डू द मैनुअल थेरेपी, इट्स हार्डली 2 to 3 minutes and you get a good result. Why? Because you are doing very intense stimulation to the मैग्नोसेप्टर्स and the proprioceptors in and around the joint. मैं अभी आपको एक्सपीरियंस करवाता हूँ। इमेजिन आप रोजाना एक भरी हुई बस में ट्रैवल कर रहे हो और अपने फ्रेंड्स के साथ ट्रैवल कर रहे हो। दैट फ्रेंड कुड बी मेल और फीमेल, बट सेम फ्रेंड है आपका, या सिस्टर है या ब्रदर है, उसके साथ ट्रैवल कर रहे हो, पूरी बॉडी आपसे टच करके खड़ी हुई है। कुछ होता है? नहीं। यू आर डिस्कसिंग आज क्लास में क्या होगा, क्या नहीं होगा, कैसे होगा, आज किससे पंगा लेना है, किससे लड़ना है, किसको प्रपोज करना है, किसको मना करना है, वही डिस्कशन रहता है ना। इमेजिन ए सिचुएशन, खाली बस में या ट्रेन में बैठे हो, बराबर वाली सीट खाली है, अपने अपने हिसाब से इमेजिन कर लेना। गर्ल्स कैन इमेजिन अ वेरी हैंडसम टॉल बॉय, 6 feet टॉल, ओके, गोरा चिट्टा हैंडसम, बिल्कुल माचो मैन, बराबर में आके बैठ गया, वरुण धवन जैसा बंदा। एंड यू पीपल कैन इमेजिन समथिंग लाइक आलिया भट्ट और समवन, समथिंग बॉयज, एंड सिर्फ एपिकोंडाइल टू एपिकोंडाइल टच हुआ, हाफ बॉडी, कितनी सेकंड में? 2 सेकंड के अंदर। Yes or no? That's the stimulation. That's the intense stimulation to the मैग्नोसेप्टर्स and the proprioceptors. 2 सेकंड के अंदर होता है। We have that much capability. Our body responds so fast. So same way, there is a transmitter, there is a receptor, right? चल रहा है, चल रहा है, चल रहा है, बोर हो गए यार। Same husband wife. A is articulating with A plus, B is articulating with B plus, C is articulating with C plus. बोर हो गया वो। मैनुअल थेरेपिस्ट है, उसने ग्लाइड दे दी। नाउ A is articulating with B plus. पड़ोसन चेंज कर दी बेसिकली, B भी चेंज हो गई है। A is articulating with B plus, B is articulating with C plus, C is articulating with A plus. पार्टी चालू है जॉइंट के अंदर। इंटेंस स्टिमुलेशन, intense stimulation to the मैग्नोसेप्टर्स and proprioceptors in and around the joint. So I call it a expressway theory, not pain gate theory, but expressway theory, because in just 2 to 3 minutes, you are not only reducing the pain, but you are also increasing the range of motion. Good, thank you very much. अच्छा, वहां से निकल जाता है, ओके, ठीक है। मैं लोगों के पास जाने की कोशिश कर रहा हूं यार। ओके, नेक्स्ट, और अगला पॉइंट बोलेंगे जल्दी से। सॉरी, इट ट्रीट द कॉज बिहाइंड द प्रॉब्लम। ओके, अभी आप इस हॉल में बैठे हैं और आपको कहीं से धुआं महसूस दे, स्मेल आए, तो क्या करोगे? आप बस एग्जॉस्ट फैन ऑन कर दोगे और कंटिन्यू करोगे इस लेक्चर को, या ढूंढोगे कि ये धुआं कहां से आ रहा है और उसको जाके ढूंढोगे? रिमेंबर, पेन इज योर फ्रेंड, नॉट योर एनिमी। कुछ बच्चे कहेंगे हाँ दोस्त तो है ही, तभी तो हम लोग कमाई कर रहे हैं, उस सेंस में नहीं बोल रहा हूं मैं। पेन इज योर फ्रेंड, इट इज ए अलार्म सिस्टम इन योर बॉडी, इट टेल्स यू देयर इज समथिंग रॉन्ग। जैसे एसीपी प्रद्युमन बोलता है ना, दया कुछ तो वजह होगी। तो जब दर्द आ रहा है ना, तो कोई तो वजह है, देयर इज अ रीजन बिहाइंड इट। You have to find that reason, you have to find that cause and fix that cause, fix that positional fault, fix that mechanical fault. If you give painkiller, if you give only the electrotherapy or hot pack, you are not treating the cause, you are only treating the pain in that case. So motivator goes, motivation goes. Same way, electrotherapy or effect of the medicine goes, pain comes back. Until unless you correct that fault, you have to correct that reason behind it. Thank you very much. Beautiful answer. So one thing is you are treating the cause behind it. You are fixing the problem behind it. Next one is you are giving nutrition to the joint because you're mobilizing the thing, and it is an intense stimulation to the joint, and of course you are increasing the range of motion. Every joint has a certain amount of joint play, and this joint play is directly proportional, sorry, every joint has a range of motion, and this range of motion is directly proportional to the joint play. Shoulder में बहुत अच्छा joint play होता है, and it moves in every direction. Sacroiliac joint, very little amount of joint play and very little of movement. Sutures, almost no movement, no joint play. Okay? So joint play is directly proportional to the range of motion. So whenever the person is injured, whenever the person is immobilized or operated and in the rest, it is the joint play which is being lost. And you being a manual therapist, it's only the passive accessory movement which will help you in gaining the joint range of motion. It's not the stretching or strengthening or massage or electrotherapy will help you in restoring the joint play. So in order to restore the joint play, you need to do the manual therapy. So these are the 4 major things. I'll show you this thing on my slide, and probably I believe in when you learn in a fun way, you learn better, you learn more. Okay? Like बहुत सारी मूवी आपने देखी होंगी, उसमें आपने नोट्स भी नहीं लिए होंगे, उसके बाद रिवाइज भी नहीं किया होगा. यू स्टिल रिमेंबर दैट. फॉर एग्जाम्पल 3 इडियट्स में मूवी के फर्स्ट हाफ में आमिर खान का क्या नाम था? अभी तक याद है, देखो, एंड कितना अजीब नाम था. डिड यू टुक नोट्स और रिमेंबर कि सर अचानक से पूछेंगे और इमीडिएटली आ गया? लेटर हाफ में क्या नाम था उसका? देखो, ये भी याद है आपको. So when you enjoy learning, when you enjoy doing something, you need not put stress on your brain. It is very easy to remember, very easy to capture and recall anytime. So we'll do it in a fun way, okay? So what I've done with these principles, I have associated some songs, and this question I'll ask later on, what is the difference between mobilization and manipulation. This is Deepak Kumar, young physiotherapist when I was in Nirtar. I'm young. So, and recently I'm blessed with my grandchildren. So we have a baby now, newborn baby in my home, and I'm a newborn dada now. So, so life is awesome. I'm blessed. So you're going to treat the cause behind it, okay? So the song, maybe आप लोगों ने ना सुना हो, शायद सुना हो. So you have to find the cause. That means your assessment is going to be more important than the treatment. आपको पता ही नहीं है टारगेट कहां है, बुलाई कहां है, तो आप हिट किसको करोगे? ओके? सो यू हैव टू फाइंड द कॉज एंड फिक्स इट. ये मेरे भी टाइम का गाना नहीं है, मेरे मम्मी पापा के टाइम का गाना है. तो आई एम श्योर आप लोगों ने तो नहीं सुना होगा. आप लोगों ने सुना 4 बोतल वोडका काम मेरा रोज का. नेक्स्ट वन इज faster pain relief because of the intense stimulation to the mechanoreceptors and proprioceptors in and around the joint. कोई जो मिला तो मुझे ऐसा लगता था जैसे मेरी सारी दुनिया में गीतों की रुत और रंगों की बरखा है, खुशबू की आंधी है, महकी हुई सी अब सारी फिजाएं. Increase in joint play and hence the range of motion. Make sense? And this gives nutrition to the joint. Bahubali thali. This photograph I clicked in Surat. And you can see my pot belly coming out. I'm a big foodie person. Okay, so it gives nutrition to the joint. इसमें कौन सा गाना बजना चाहिए? आपको क्या लगता है? बोलो? कौन सा? जोर से बोलो थोड़ा सा. दावते इश्क है. अच्छा, वो इश्क की दावत दे रहा है, खाने की दावत नहीं दे रहा है भाई. गाने का रियल मीनिंग कुछ और है। मैंने जो सेलेक्ट किया वो ये किया है।
भूख लगी, भूख लगी, भूख लगी।
This is what the joint is asking therapist, that I need nutrition, give me something. Okay. So ये दावते इश्क वाले लोगों के लिए थी तलवार। क्लास में ध्यान नहीं है इनका, इश्क में ध्यान ज्यादा जा रहा है। Okay, so what is the difference between manipulation and mobilization? Everyone knows that definition, and it's very beautifully given in Dina Gardner already, and we'll not be spending much time here. We'll be directly jumping to the presentation now. So this is one of the patient. I'm showing you the few cases, and then we'll start the demonstrations. I'm sure you people can appreciate the slip disc here. Okay. And this one, shall I zoom it so you can see more? Can you see the size? Okay. And this patient after one and a half year. तो अगर आपको लगता है स्लिप डिस्क खाली सर्जरी से अंदर जाती है तो ऐसा आपको लगता है। There is a therapist in his name is Balaji, he is my student in Chennai. वो एक महीने ये स्लिप डिस्क को ट्रीट करने का पैकेज देता है सीधा सीधा 4.5 लाख रुपए का। एंड ही सेज 4.5 लाख में आपकी सर्जरी करवानी है या बिना सर्जरी के ठीक होना है, पैसा तो आपका 4.5 लगेगा। अब आप डिसाइड करोगे विद सर्जरी और विदाउट सर्जरी। पेशेंट गोज टू हिम और 10 पेशेंट उसने पर डे ट्रीट कर लिए, तो अब सोचो कि कितना कमा रहा होगा वो। ऑफ कोर्स एक दिन का नहीं है ये पैकेज, उसका 1 महीने 2 महीने का पैकेज है ये, बट दिस इज हाउ मच मनी ही इज मेकिंग। कुछ लोगों की आंखें खुल के बाहर आके गिरने को तैयार है। These are the facts. These are the facts. This is what the scope of physiotherapy is. Now see the transverse section. I'll show you the larger image. Look at the disc. Same patient, same level. Look at the disc. You people need to go beyond increase in blood circulation. Physiology आपको SCB मेडिकल कॉलेज में इसीलिए पढ़ाई गई थी. There is a phagocytosis and there is a shrinking of the disc, and then there is a mobilization. Combination of multiple things happening, and patient recovers without any surgery. They recover. और डिस्क अगर है भी तो कौन सी आफत आ गई यार। At the age of 40 and 50, more than 50% people have the slip disc, and they are asymptomatic. Maybe the pain is not coming because of the slip disc, maybe it is coming because of the impingement of the sanual fold or the cartilage inside the facet joint or the muscle spasm or the rotation of the vertebrae got stuck. So you just need to mobilize them. That's it. स्लिप डिस्क देखते ही पागल नहीं हो जाना ये डिस्क डिस्क है, डिस्क डिस्क। ये डिस्क नहीं आसान दर्द का दरिया और शॉर्ट वेव लगवाना है, ऐसा नहीं होता है। Many times we have seen patients, they had slip disc, they went for surgery and they still have the absolutely same pain. That means the pain was not coming from the slip disc, it was coming elsewhere. मजे वाली बात पता क्या है, पारिफॉर्मिस सिंड्रोम नाम की चीज ऑर्थोपेडिक्स में एग्जिस्ट ही नहीं करती। उन लोगों को ना डायग्नोस करनी आती ना पता होता। फेसेट जॉइंट को वो लोग ज्यादा बिलीव नहीं करते, फ्लेक्शन एक्सरसाइज को बिलीव नहीं करते, हर चीज में वो सुपरमैन बनाने की कोशिश करते हैं, एक्सटेंशन एक्सरसाइजेस। माय क्वेश्चन इज, भाई पेशेंट तुम्हारे पास चल के आया, दैट मींस इरेक्टर स्पाइन तो उसकी ऑलरेडी काम कर रही है, और क्यों स्ट्रेंथन करना है? What you need to strengthen is the multifidus. कल मोहंती सर ने ऑलरेडी डिटेल में बोला ट्रांसवर्स एब्डोमिनिस और मल्टीफिडस के लिए। So you need to work on multifidus. And he also taught you how to do the strengthening for transverse abdominis and multifidus. Don't work for erector spine, please. You need to release it. वो already tension में है, इसकी pain आ रहा है उसको. You need to stabilize. You need to give the strengthening of the dynamic stabilizer. इरेक्टर स्पाइन तो पोस्चरल मसल है, अगर पेशेंट खड़ा हो पा रहा है, बैठ पा रहा है, तो इसका मतलब उसका तो ग्रेड 5 है ना, नहीं तो पेशेंट बैठ भी नहीं पाता. So work for the multifidus, work for the transverse abdominis. Okay, so just few more cases. Can you see the scar here? And this patient had a failure of this implant, so he had to go for the second surgery. This patient was referred to physiotherapy department after 1 year of surgery, because उससे पहले mobilize करना allow नहीं था. 1 साल से कंधा नहीं चलाया और 2 बार सर्जरी हुई है. अब मुझे बताओ इसका रेंज ऑफ मोशन, फ्रोजन शोल्डर बिल्कुल 0 डिग्री. फ्रोजन शोल्डर कितने दिन में अप्रोक्सीमेटली इन योर एक्सपीरियंस यू विल बी एबल टू रिगेन द रेंज ऑफ मोशन अप्रोक्सीमेटली? एनी आइडिया? क्लिनिशियन, दोज हु आर मोर देन 5 years ऑफ एक्सपीरियंस, रेज योर हैंड. सर बताओ कितने दिनों में या महीनों में या हफ्तों में ठीक हो जाएगा रेंज ऑफ मोशन, या ठीक होगा या नहीं होगा? थोड़ा जोर से बोलो ना. ये फ्रोजन शोल्डर वैसा वाला फ्रोजन शोल्डर नहीं है, ये ट्रॉमेटिक है, 1 साल से चला नहीं है. मिनिमम 6 months अप्रोक्सीमेटली, है ना? यू ऑल एग्री विथ 6 months? ओके. विथ मैनुअल थेरेपी 4 weeks. अब बताओ ज्यादा पैसे चार्ज करोगे या नहीं करोगे? अब तो बनता है ना पैसा. 6 महीने की फीस 1 महीने में लो ना, क्या दिक्कत है? पैसा उतना ही लेंगे, लेकिन 6 महीने में नहीं, 1 महीने में लेंगे. लुक एट द फ्लेक्शन नाउ, लुक एट द इंटरनल रोटेशन. सबसे पहले आती है रेंज ऑफ मोशन. अगर आप कन्वेंशनल थेरेपी करते हो ये सबसे बाद में आती है. आई विल शो यू द टेक्निक जिसमें ये सबसे पहले आएगी. और जब आप रोटेशन खोलते हो तो फ्लेक्शन अबडक्शन अपने आप खुल जाता है. एक्सटर्नल रोटेशन इसका अभी भी रिस्ट्रिक्टेड था. जब हमने फोटो लिया उसके बाद पेशेंट काफी खुश था, उसने आना बंद कर दिया, तो उसका फॉलोअप मेरे पास में नहीं है. एक दूसरा केस देखो, इसको एडवाइस किया टोटल शोल्डर रिप्लेसमेंट के लिए, आर्थोप्लास्टी के लिए इसको बोला, ही सेड नहीं कराना मेरे को बिकॉज शोल्डर रिप्लेसमेंट के बहुत अच्छे रिजल्ट नहीं है. इसको 6 महीने बाद हमारे पास रेफर किया बिकॉज तब तक वो यूनाइट हो जाए. सी द रिजल्ट नाउ, माल यूनाइटेड है ये. नाउ दिस इज बियॉन्ड द साइंस. यू पीपल मे आस्क सर वो तो टेढ़ा है, ये है वो है, कैसे ज्वाइंट का मूवमेंट आएगा? इसका आंसर मेरे पास भी नहीं है. This is something beyond science. People do recover. I'm sure you people must have seen people with the avian of the hip or the hip का पूरा bone collapse हो गया है, pseudo joint बन गया, but they are moving around. वहां पे आपकी साइंस काम नहीं करती है. They are not going for total hip replacement. They are moving around. They are happy. So he got the full range of motion, abduction, flexion, internal rotation, even the external rotation. Again 4 weeks. And look at the smile at the face of the patient. फिर किक मिलता है क्लिनिक के अंदर जब पेशेंट ऐसे रिकवर करते हैं, तो मजा आता है. क्लिनिक में जाने का मन कर रहा होता है, छुट्टी मारने का मन नहीं करता. बिकॉज क्लिनिक में घुसते पेशेंट ये नहीं कहते हैं आगे आओ कहते दिन लॉगी, वो आपको मजा आता है. अरे वाह देख और कैसा है, बेटर हूं, और 10 पेशेंट सुन रहे होते हैं. वो पेशेंट दूसरे क्लिनिक में नहीं जाते, फिर आपके पास चिपक के रहते हैं, सर मुझे भी वैसा रिजल्ट चाहिए. दिस हाउ यू इंक्रीज योर प्रैक्टिस. लुक एट द स्लिप डिस्क अगेन. Look at the, this is a posterior central one, and this boy came with SLR of 10 degree. That's it. And he came on a stretcher. He came on a stretcher. 10 degree SLR. And we did a maneuver. This is the range of motion. And you know how much time it took? Any idea? 120 seconds. 120 seconds. And this patient went driving his car. So I'm going to demonstrate these techniques to you. Don't worry. लालच भरी निगाहों से मत देखो, यहाँ दिखाने वाला हूँ मैं सारी techniques. We are going to teach you. Then look at this patient. He was admitted in a hospital where I'm working for the total hip replacement, and the patient was referred for pre-operative therapy. So my orthopedician referred him for the preoperative physiotherapy for the preparation. And then we said, anyway, she's going for the hip replacement. So we tried to do the MWM for the hip joint. Earlier, she was not able to touch the feet. She was not able to do the cross leg sitting. She was not able to do many things. And we did this maneuver. In single sitting, we gained this much of range. And my orthopedician was nice enough and good enough to say that, madam, you don't need total hip replacement at present, because she was a case of rheumatoid arthritis, very young patient. So he wanted to delay this surgery. Dr. Shekhar Agarwal, you might have heard his name. Okay, so he refused to operate on her, and he said, no, you continue with the physiotherapy, and later on, whenever you need surgery, we will operate on you. Because anyway, she will need surgery because she's a RA case. She will need surgery one day for sure. So, but in the single sitting, she could touch the feet, she could go up and down the stairs. Partially, she could do the cross leg sitting also. Earlier, she was not able to do it. This is another and the last case, very important case. Look at the fracture, multiple piece. But because it is undisplaced, so my ortho referred her to the therapy after 6 weeks. So you can see the various views, okay? And on first day, she was crying. It's very much visible from her face. She was crying that, what will happen? How will I recover? Will I get frozen shoulder? Or will I recover? Will I need surgery? Okay? Now, I asked her, if you agree to give me the photographs, I took her consent, of course. I'll treat you much faster way. And she agreed. This is the range we gained after 6 visits in 1 week time. From this to this, and 2 weeks. This is just 2 weeks. 12 sittings in 2 weeks time. Look at the abduction. Look at the internal rotation. And remember, this is the affected one. Don't get confused with the other side. Look at the external rotation. Patient का body language देखो, makeup भी आ गया चेहरे पे, बाल बांधने का style change हो गया, lifestyle. These are the blessings you get from the patient, not just the money. Will this patient go to some other clinic in future? No, never. Just 2 weeks, 12 sittings, that's it. And you get beautiful results. Look at the external rotation also. But this does not mean whosoever walk in your clinic is the case for manual therapy. And remember, there is a difference between manipulation and mobilization. Many times when you talk to your orthopedician and you say mobilization, sometimes they get afraid. They say, no, 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 don't do manipulation, because they think it is the same manipulation what they do under anesthesia. However, what manipulation we do is very, very different what they do. And only 5% patient actually need manipulation. 95% patient recover beautifully with mobilization. Mobilization, I'm saying. I'm not talking about high velocity thrust. I'm talking about mobilization, okay, not HVT. So you need to be good enough and effective enough to talk to your referring source. Sir, I'm not manipulating the patient, I'm mobilizing the patient. Okay, so what are the yellow flags and the red flags? You don't do it in case of osteopenia, pregnancy and hypermobility. Okay, because there is chances of pathological fracture is there. And in case of pregnancy, you don't do it because release of the hormones, release of the certain hormones, and there is a ligament laxity, so you need to be extraordinarily careful. We'll continue in a few minutes. We have an important guest with us, and I want you all to welcome head of the orthopedic department of AIIMS. Dr. Mohanty will introduce him in a proper way.
Very good morning to all of you. Thank you, Deepak sir, for the wonderful lecture continuing. And I take the pleasure of inviting my friend, my in fact school friend, Sunny school friend, Dr. Vishnu Prasad Patra, and give a big clap for him. So while we were studying in Nirtar, I used to tell about P.P. Man sir, Mona madam, and once he visited to my hostel and stayed with me one overnight and he has got a very high regard for all the faculty members of SB Nirtar. And he's doing one wonderful work because I keep meeting various orthopedic surgeons across the country. Let it be Dr. Sumant, a very pioneer sports surgeon in Mangalore. He also knows him very well. And recently I met in Amritsar one Dr. Inderjit Singh. He is also a very sports reputed orthopedic surgeon. He is very, he knows Vishnu very well. He has got a lot of patents, nearly 7 to 8 patents he has already done along with IIT Bhubaneswar. And he has been done a fellowship in South Korea. He tells a lot of stories. And he has got a very high regard and respect for all the physiotherapy fraternity because he is very well connected from so many years in our field. And I invite Dr. Vishnu Prasad Patra, the head of Department of Orthopedics, Orthopedic Surgery of AIMS Bhubaneswar, and he has taken the orthopedic department to a very excellent level in the country now. So we are very happy to invite him, and I am actually very lucky to have a friend, philosopher like Dr. Deepak Kumar, and guide like Dr. P.P. Mandi sir, Mona madam, and really enjoying the session. Sir, please continue.
Thank you.
Yes.
Thank you, sir, for chairing the session. We are really, truly honored. Thank you very much. Okay, so what are the red flags then? Red flag means absolutely no manual therapy. You have to be extraordinarily careful in selecting your patient. So in case of tumor, you don't do it. Why? Jaldi se koi bolo. Why? In case of tumor, you don't do it. Koi bolo jaldi. No, we are doing it for reducing the pain. Metastasis, why? Increase in blood circulation, more oxygen, more. I was expecting this. That's why I asked this question. Hello, you don't do it because of the chances of pathological fracture. Now our orthopedician friend is sitting here. He will tell you when there is a tumor in the bone, they are so soft. They don't use a scalpel. Even finger से ऐसे निकल के आ जाता है मक्खन की तरह से सर बोन. और उसको आपने मैनिपुलेट किया तो भैया पेशेंट की तो लगा दी तुमने. हो गया काम. So it's not metastasis हो जाएगा. You will mess up the thing, not metastasis. You will mess up the thing. It will be a pathological fracture there. Same thing is true when the patient is having any metabolic bone disease like osteopenia or something or osteoporosis. So you don't do that way. Okay, then patient is if the patient is on anticoagulant therapy, again you need to be very careful while doing the mobilization, but extra careful, or you should not do it. You should not do the high velocity thrust or the manipulation. Okay. Then if the patient is having aortic aneurysm और thoracic को आपने manipulate किया, patient के नाम के पीछे था लग जाएगा. क्या लग जाएगा? था. बहुत अच्छा आदमी था, पेशेंट रेफर करता था, रोज आता था, कभी कभी समोसा भी लाता था. वहीं अंकल, वहीं death on table, and nobody in the world can save you if the patient have a death on table. Okay? तड़पता भी नहीं है पेशेंट. वहीं वो मूवी में था ना डायलॉग, मैं जाके छू के वापस आता हूं. ये छू के वापस नहीं आएगा, छू के वहीं चला जाएगा. Then if the patient is having neurological deficit, yesterday we discussed it already. Someone asked for the spondylolisthesis grade 3. Okay. So remember, multi-level PIVD is not a contraindication, rather it is an indication. But because of this, or because of the cervical myelopathy or slip disc, if patient is having if the patient is having neurological deficit, cauda equina, altered sensation is not a problem. Loss of sensation, increased or decreased DTR, increased or decreased muscle tone, bowel and bladder involvement, then there is a problem. Don't do that. You need to refer that patient back to orthopedician. At the same time, I have seen few cases who says, sir, my cardiac condition does not allow, my lungs does not support, I'm too